Hi, my name is Andrew Sears, and I'm the president of City Vision University, and I'm going to give you an overview of addiction counseling, licensing, and certification. So just to explain, most states in the United States will provide something either called licensing or certification. In most states, it's called certification for addiction counselors. And what that does is that authorizes that person to be an addiction counselor. Um, Most states are going to be following a certification model or licensing model and standards coming from SAMHSA, NADAC, and or ICNRC. And it's important to recognize that certification is distinct from a certificate. So City Vision gives a certificate, but that doesn't license you by the state. You have to go through a separate process on that. So most states will have some combination of four things. So education hours and City Vision courses will typically count towards that. Some states may require local in-person training for certain components. And then there's an exam, and City Vision courses are aligned to help you pass that. Some states will require supervised practicum hours, and you can do that through our practicum course. And then pretty much all states will require work experience hours. So as I mentioned, the certifications typically are aligned with SAMHSA, so that's the United States federal standards on addiction counseling provides most of those standards, and they have a career ladder. So in the career ladder, you have different levels. So down here is typically the name. These are the jobs. And so you have peer support specialist, and then most states will have something that sounds similar to this. So certified addiction counselor 1, and then certified addiction counselor 2, and then master addiction counselor. But then a lot of states will also have a certified clinical supervisor. So those are the main certifications. Different states will have different levels. So in City Vision programs are designed to kind of cover these different levels. So as you look at various states, and I'll just use an example of a state. So in this state, this part here is actually Missouri, so they require 180 education hours. So City Vision programs will count towards that. You can get the practicum going through City Vision, and then you take an exam that's called the ICNRC exam. So we'll help prep for that. And then the experience hours are going to be covered by the employer, and the different levels of experience hours depend on what degree level you get. So not all states are like that. So that's for the certified addiction counselor. But then you can look at the master addiction counselor, or the licensed addiction counselors is what some states will call that. And often that will require a master's degree, a certain amount of practicum hours, the MAC exam, and then experience hours. So you should look at your own state requirements for this. Now, to explain City Vision's program path, so we start with a certificate program at the undergraduate level. That's 6 courses. That builds towards an associate's, then that builds towards a bachelor's. So there's new regulations that went into effect in 2024 that now require that City Vision indicate whether each of our programs meets the requirements for certification and licensure. Because of that, we are focusing one program, one concentration. The clinical addiction counseling concentration is particularly designed to meet the state standards for CAC1 and often CAC2. And if you're doing the other concentrations, then basically it's not necessarily designed to meet those standards, but you can look at your state requirements to figure out whether it does. So there are certain states that we aren't going to be offering this clinical concentration and path to licensure. So if your state is on one of these lists, you need to pick one of these other concentrations. And in general, we recommend that you don't plan to use City Vision as your primary education component. Usually that's the key component for your state getting certified. Now, having said that, there's a lot of states, going back to this example here, Missouri, it's only 180 hours, so you could probably take a couple courses locally and still meet that education requirement. So, and then peer specialist is going to vary by state, and you should just look at your own state requirements. So that's at the bachelor's level. So our addiction counseling bachelor's is designed to meet that. Having said that, in a lot of states, if you look at the requirements, so just as an example, the Missouri requirement, you're going to meet that licensure, education hours way before you get to the bachelor's. But we just wanted to explain that this is designed to meet it across the most number of states. So then we have the addiction counseling graduate certificate. So all the credits here stack and add towards the next level. So we have addiction counseling graduate certificate that's 12 credits. And then in the master's, we have 3 concentrations also slightly different. We have the clinical addiction counseling. Then we also have a Christian recovery ministry. So the clinical addiction counseling is designed to prepare you for the master addiction counselor and clinical addiction counseling supervisor certification. But then we also have a pre-LPC track, and that's designed to transfer up to 27 credits to Liberty's 60 credit masters, leading to an LPC. Now, I realize this can be confusing now that there's these new regulations. So if you have questions, please ask our admission staff, and they can help you with this. But the short answer is, look at your state requirements. But if you're in one of these states, then we don't recommend using us as your primary education component to get your certification in your state. So the other thing to realize is often the education components are aligned with what's called TAP 21, the 8 practice domains of addiction counseling that comes from SAMHSA. And some states may require that you get so many hours in each of these domains. Sometimes they'll have them in different categories. And we can work with you to map the courses if you're in a state. I'd say probably only a handful of states have requirements in specific domains until at least you get to the master's level, and that becomes more common. So, one of the questions is, if we're providing, everything aligned with these standards, what does it mean to be Christian? Well, one of the things we do is we provide Christian integration in all of these different domains, and we're integrating all these domains in a Christian worldview. So you can ask the question of what's going to be different about an approach that a Christian might take on this, especially if you're working at a Christian ministry. So that's one of the things that we specialized in. Now, it's important to recognize the full development path in addiction counseling, because I focused on SAMHSA's career ladder, but there's a larger career ladder. So SAMHSA's career ladder is, maybe a shorter ladder, and there's a much taller ladder to recognize. So this part here, the Certified Peer Specialist and the CAC1 and CAC2, these components, and also the MAC, those are all a part of SAMHSA's ladder, but often there are additional rungs that are beyond the addiction counseling. So often, if you want to keep moving up in pay, you'll go on. The most common counseling degree to go for is an LPC, licensed professional counselor. Often that has a big pay bump. Some people will go with a licensed marriage and family therapist, and or a master's in clinical social work. I would say often this costs the most and takes the most credits, but often has a little bit of a pay bump compared to the LPC or the LMFT. And all of these have significant pay increase compared to the MAC. And the big reason is that most states require these licensures for billing, insurance, and Medicaid. Some states will allow the MAC to do that. So that means you get better pay and it's more marketable. So it can also be helpful to kind of look at this from an org chart of a large licensed treatment center and the pay ranges. So at the top, often in a large licensed treatment center, you might have a psychiatrist or a medical doctor, and the pay might be $100K to $250K, depending on where you live and how big the organization is. And this is just averages. There's going to be people who are outside of these averages. And then LPCs are going to get paid typically maybe 50 to 90,000 in one of these centers, but the MAC are going to be a little bit less than that. So that's the master addiction counselor, 40K to 70K, and then the licensed clinical social worker, 60K to 100K, and then the clinical psychologist, which is a little less common, at least in the addiction field, where it's 60K to 100K. And then you have the licensed addiction counselor. So depending on where you live, it might be as low as 30K or 50K. It could be higher in some places. Peer specialist often is, some states it's a, almost minimum wage. So 20K to 40K. So as you're thinking about your career ladder, you might be thinking about, okay, so I'm starting as a peer specialist, and I'm going to go for the licensed addiction counselor, then I'm going to get my MAC, and then the most common path is to become an LPC. So hopefully all that's helpful. And again, please ask our admissions staff or others at City Vision. We'd be glad to give you more advice. Thanks a lot.